In the last module, we discussed the importance of bone markings, and in this tutorial, I'd like to demonstrate some specific bone markings in the upper appendicular skeleton and talk about their relevance to a muscle group that you'll be studying in the upcoming muscle tutorial. Remember that bone markings are going to be very important features for identifying areas of articulations between bones, sites of attachment for muscles and ligaments, landmarks that are sometimes useful to name muscles, and also as passageways for blood vessels and nerves. Also keep in mind that in the laboratory this week, knowing bone markings is not only going to be very useful, but also necessary in differentiating left and right disarticulated bones. In this tutorial, we're going to focus on a few select bone markings of the humerus and the scapula. And here we're looking at the left posterior side. Let's begin with the humerus. One of the most prominent markings in the humerus is the hemispherical head of the humerus, and I've highlighted that here in blue. The head is a round feature on the epiphysis of the humerus, and it articulates here at the glenoid fossa, also called the glenoid cavity of the scapula, and this articulation forms the glenohumeral joint. Next, we'll take a quick look at the greater tubercle, and I've highlighted that here in blue. The greater tubercle is located laterally, so we don't have a really good view of it from the posterior side, but we'll get a better look at both the greater and lesser tubercles when we look at the anterior view in a moment. The tubercles are important because those are the sites of insertion of the muscles of the rotator cuff. The humerus has two necks. First, we have the anatomical neck, which is between the tubercles and the head of the humerus, and this is the location of the former epiphyseal growth plate. Next, we have the surgical neck, highlighted in blue, which is just distal to the tubercles at the transition from the head to the shaft of the humerus. This is called the surgical neck because it's a very common site for fracture of the humerus. Next, we'll take a look at the scapula. I've highlighted here in blue the spine of the scapula, which is a slender ridge of bone on the posterior aspect. And if you come along the spine here, it's continuous with the acromion process right here. And then we have two important fossa on the posterior side of the scapula. First, we have the supraspinous fossa, highlighted in blue, above the spine, and then the infraspinous fossa, which is below the spine. And these fossa provide sites of origin for two of the muscles of the rotator cuff that are going to stabilize and move the shoulder joint. Next, let's flip over to the anterior surface of these bones. Here we're looking at the left anterior surface of the bones, and I want to point out a few features which are also going to be important sites of muscle attachment. On the scapula, we have another fossa called the subscapular fossa, highlighted in blue, and this is the site of origin for the subscapularis muscle. Here we can see just the tip of the acromion process coming over from the posterior side, and this is the clavicle, and you can see that the acromial end of the clavicle here articulates with the acromion process of the scapula. So in the laboratory, when you're differentiating right and left clavicles, you can use that acromial end of the clavicle as a clue as to which bone is the left or the right. Here we can see the rim of the glenoid fossa or the glenoid cavity, which is highlighted in blue. And we can just see the rim of that fossa here articulating with the head of the humerus. Finally, on the humerus, I want to emphasize the tubercles, which can be clearly visualized on the anterior surface of the humerus. First, we have the greater tubercle, which is the larger, more lateral of the two. And then we have the lesser tubercle, which is the smaller, of the tubercles, it's more anterior and more medial than the greater tubercle. While the fossa that we looked at on the scapula are important sites of origin of the rotator cuff muscles, these tubercles on the humerus are the sites of insertion of all the muscles of the rotator cuff. So let's move on to the next tutorial and we'll take a closer look at those muscles of the rotator cuff.